How's it going, guys? We have a past little question for gastrophysio step 1. 24-year-old man partakes in a research study in which he is exogenously administered various concentrations of factor X, and this causes bicarb secretion from the pancreas. And the question wants to know just simply which of the following is factor X. It's past little, as I said. So let's just hop through the answer choice here. Choice A, cholecystokinin, CCK, wrong fucking answer. So you need to know that CCK is going to do three things. Number one, it's going to cause protease and lipase secretion from the pancreas, not bicarb. Now, where some students can fall into a trap is they hyperanalyze every little minute function that a hormone or enzyme can theoretically carry out, where they say, OMG, Michael, theoretically CCK could increase bicarb secretion. It's fucking wrong, okay? So for USMLE, it's going to be proteases and lipases from the pancreas, as well as contraction of the gallbladder, relaxation of sphincter of Oddi. And you need to know the impetus for CCK secretion, i.e. what causes CCK to be secreted in the first place, is going to be macronutrients passing from the pylorus into the duodenum. Okay, so that means proteins, lipids, carbohydrates. Now, once again, make a million tangential points here. Some students say, well, can't acid theoretically cause CCK secretion? Also fucking wrong, okay? So it's macronutrients, proteins, lipids, carbohydrates, and then the pancreas is going to secrete protease and lipases as a result. And one of the NBMEs wants you to know that CCK is secreted by enteroendocrine cells of the small bowel. That's, quote, the answer. Okay, so they give you an easy question about CCK. They ask which of the following cells/cell type secretes it, and the answer is just enteroendocrine cells of the small bowel. Wrong fucking answer. Choice B, gastrin, wrong fucking answer. Secreted by G cells, okay, causes the parietal cells to increase acid production. So you could be thinking of things like gastrinoma, Zollinger-Ellison syndrome, high yield, part of MEN1 syndrome. Okay, a lot of tangential points we can make. But when we think about MEN1, pancreas, pituitary, parathyroid, they like Zollinger-Ellison for the pancreas. And also gastrinoma presents as recurrent duodenal ulcers. Okay, so most duodenal ulcers are due to H. pylori, but if you're H. pylori negative, then of course it could be Zollinger-Ellison syndrome. So the three mechanisms for parietal cell acid secretion: number one, gastrin binding directly to gastrin receptors on parietal cells. Number two, enterochromaffin-like cells secrete histamine, which bind to H2 receptors. Gastrin is going to cause enterochromaffin-like cells to secrete histamine, and then the histamine is going to go to the parietal cells and bind to H2 receptors, okay, which increases acid secretion. So we said the first mechanism was gastrin binding directly to the parietal cells at the gastrin receptors. Our second is gastrin causes an increase in histamine, which binds to histamine 2 receptors in the parietal cells. And our third mechanism is going to be vagal stimulation, okay, muscarinic receptors on the parietal cells. Wrong fucking answer. Choice C, glucose-dependent insulinotropic peptide, wrong fucking answer. Okay, so this is weirdly a high-yield hormone for physio for step 1, okay, despite the fact that it sounds nitpicky and pedantic. So what you need to know is that this hormone is the reason why the body is able to process oral glucose better than parenteral IV glucose, okay? So there's two ways they're going to ask this. The first way, they're going to say, just simply a patient is given, one patient's given 50 grams of oral glucose, another patient given 50 grams of IV glucose, and then the patient who's given the oral glucose metabolized it faster. Why? The answer is glucose-dependent insulinotropic peptide causes a spike in insulin. Okay, so if you administer oral macronutrients, not just carbohydrates, it can be fats, it can be proteins. So all three macronutrients can cause this enzyme to increase, which causes insulin to go up, which will help with metabolism of oral glucose faster than parenteral glucose. That's the first way they ask it. The second is they just say simply, patient A is given 50 grams of IV glucose. Patient B is given 50 grams of IV glucose plus oral fatty acids. Holy shit, okay? And then they say patient B metabolizes that IV glucose faster than patient A, and the reason is because glucose-dependent insulinotropic peptide, that's the hormone that you're going to select. Wrong fucking answer. Choice D, secretin, correct answer. So you need to know that secretin's function is to cause the pancreas to secrete alkaline bicarb. Not dramatic, okay? And then the impetus for secretion is going to be protons, acid passing from the pylorus into the duodenum. Not complicated. Let's just hop through the final answer choice here. Vasoactive intestinal peptide, wrong fucking answer. You need to know this causes the pancreas to secrete increased water content. Now, it does show up on an NBME question somewhere. They give you a graph just like this, and you can see that they give you lines for bicarb, etc. So bicarb, the pH doesn't change. The proteases, lipases don't change, but the water content increases. You're like, what's going on here? They ask for the hormone, it's VIP. Okay, so bicarb increases, that's secretin. Proteases, lipases, that's CCK. So, and VIPoma for 2CK surgery, for whatever reason, is extremely high yield. It shows up on different forms. So VIPoma, aka Werner Morrison syndrome, aka WDHA syndrome, watery diarrhea, hypokalemia, achlorhydria, so low chloride, hypokalemia, low potassium, watery diarrhea. That's a presentation for VIPoma, and then it can also present without WDHA syndrome and other surgery questions where you get a lacy facial rash, which is a little bit unusual as well, but I'm telling you it shows up. And not to be confused with necrolytic migratory erythema, which is a fancy rash you can get with glucagonoma, which of course the latter you would have increased serum glucose. Wrong fucking answer. You know the deal. To make more content. If you like my stuff, subscribe my channel. I appreciate your time. That's it.